Vienna, 1846. In a bright white hospital ward, dozens of women screamed in agony as they gave birth, and then, in silence, they died. It was called childbed fever, a mysterious plague that struck new mothers just hours after delivery. Nobody knew why. The death toll was staggering. Sometimes 1 in 3 women died in that same hospital, leaving behind newborns who would never know their mothers. And then came a young Hungarian doctor named Ignaz Semmelweis. He noticed something strange, something everyone else had missed, and what he discovered should have saved millions of lives instantly. Instead, it destroyed him. The deadliest room in Vienna. In the mid-19th century, Vienna was the glittering capital of the Austro-Hungarian Empire, a city of music, culture, and science. The Vienna General Hospital, or Allgemeines Krankenhaus, was one of the most prestigious medical institutions in the world. Doctors came from across Europe to learn there. But in its maternity ward, a silent horror unfolded every day. The hospital had 2 separate maternity clinics. Clinic 1, staffed by medical students. Clinic 2, run by midwives. Women were admitted to whichever clinic had space. But soon, expectant mothers began begging, literally begging, to be admitted to Clinic 2. Some even gave birth in the street rather than risk entering Clinic 1. Why? Because the difference between them was life and death. In Clinic 1, the mortality rate was as high as 30%. In Clinic 2, it was less than 3%. The same building, the same women, the same city. So what was killing them? The young doctor from Budapest. Ignaz Semmelweis was born in 1818 in Buda, now part of Budapest, Hungary. He was brilliant but humble, the son of a grocer, with a restless curiosity about the natural world. After earning his medical degree, he went to Vienna to specialize in obstetrics, the art of childbirth. He was methodical, almost obsessive. He noticed patterns where others saw chaos. When he started working in the hospital's Clinic 1, the death toll haunted him. He watched healthy young women, some as young as 17, deliver healthy babies and then die agonizing deaths within days. Their bodies burned with fever. Their abdomens swelled, pus oozed from their wounds. Post-mortem examinations showed inflamed organs and foul-smelling tissue. Doctors called it puerperal fever or childbed fever, but no one knew the cause. Theories abounded. Maybe it was miasma, bad air, or perhaps fear or shame or even God's punishment. Some believed it was inevitable. Semmelweis refused to accept that. The clue in the morgue. Then, in 1847, tragedy struck and gave Semmelweis his answer. His close friend and colleague, Dr. Jakob Kolechka, died suddenly after cutting his finger during an autopsy. Within days, he developed the same symptoms as the mothers who died of childbed fever: fever, infection, and death. Semmelweis was stunned. He realized something terrifying. The symptoms were identical. Doctors performing autopsies were dissecting corpses in the morning and then, without washing their hands, delivering babies in the afternoon. They were literally carrying death from the morgue to the maternity ward. The invisible particles of decay, what we now know as bacteria, were killing mothers. No one knew about germs yet. Louis Pasteur's germ theory was still decades away. But Semmelweis didn't need to know what they were. He just knew they existed. The hand-washing revolution. Semmelweis decided to test his theory. He ordered every medical student and doctor in Clinic 1 to wash their hands in a solution of chlorinated lime before examining any patient. At first, they complained. The lime solution smelled terrible and stung their skin. But Semmelweis insisted. Then, within weeks, something miraculous happened. The death rate plummeted from 18% to 1%. For the first time, the morgue-like clinic became a place of healing. Women stopped dying. The cries of grief turned into cries of newborns. Semmelweis had done it. He had found a way to stop one of the deadliest killers in medicine. It should have been the greatest medical breakthrough of the century, but instead of being celebrated, he was mocked. The backlash. To modern ears, it seems unbelievable. How could anyone reject such clear proof? But in the rigid world of 19th century medicine, Semmelweis was challenging far more than bad hygiene. He was challenging ego, hierarchy, and tradition. Doctors were gentlemen, men of science, refinement, and learning. The idea that they themselves were spreading death with their own hands was unthinkable, even offensive. Many senior physicians took it as a personal insult. They argued that Semmelweis's data was flawed, that childbed fever was caused by atmospheric influences, not dirty hands. Some accused him of hysteria. Semmelweis was not a politician. He was blunt, passionate, and quick-tempered. When his colleagues resisted, he lashed out. He called them murderers. He wrote later, "When I look back upon the past years, I can only call it murder. I have tried in vain to save the lives of mothers, but my word has not been heeded." Instead of accepting his findings, the hospital's leadership turned against him. The exile of a genius. By 1849, Semmelweis's contract was not renewed. He was quietly dismissed from the Vienna hospital. He returned to Hungary, heartbroken but determined. There, he implemented his hand-washing protocols at the St. Rochus Hospital in Pest. Once again, the results were spectacular. Maternal deaths dropped to almost zero. But outside his hospital, the medical establishment still ignored him. He wrote letters, begged universities to listen, and sent data to medical journals. No one published his work. In 1861, he self-published a book titled The Etiology, Concept, and Prophylaxis of Childbed Fever. It was long, angry, and poorly edited, written in a feverish tone that reflected his growing desperation. Few read it, fewer believed it. The descent into madness. Years of rejection took a toll. Semmelweis grew increasingly erratic, paranoid, and emotional. He accused prominent physicians of killing patients through negligence. He disrupted lectures, shouting that their theories were lies. Friends and family began to worry about his mental health. In 1865, at the age of 47, his wife and colleagues lured him to a mental asylum near Vienna under the pretense of visiting a new medical facility. Once inside, he was seized and beaten by guards. Within 2 weeks, he was dead. The official cause? A gangrenous wound on his hand, likely infected during the scuffle, the same kind of infection that had killed the mothers he had tried to save. He died of sepsis, the very disease he had dedicated his life to eradicating. Vindication too late. A few years after Semmelweis's death, other scientists began proving what he had known all along. In the 1860s, Louis Pasteur demonstrated that microorganisms cause disease. In the 1870s, Joseph Lister pioneered antiseptic surgery, using carbolic acid to disinfect wounds, inspired by Pasteur's findings. Lister later acknowledged Semmelweis's work as a crucial precursor. By the late 19th century, hospitals across Europe had adopted strict hygiene protocols. Hand washing became standard practice. maternal deaths dropped dramatically. But for Semmelweis, recognition came too late. He had died alone, forgotten, and ridiculed, a martyr to science. Legacy of the Savior of Mothers. Today, Ignaz Semmelweis is celebrated as one of the founders of modern medicine. Hospitals, universities, and even asteroids bear his name. Statues of him stand outside medical schools. Every time a surgeon scrubs before an operation, every nurse washes her hands between patients, every doctor sanitizes. That's Semmelweis's legacy. But his story is more than medical history. It's a warning about arrogance, denial, and the cost of truth. Semmelweis's tragedy reminds us that even the greatest discoveries can be crushed by